Now, we've already discussed the stages in the healing of fractures. Again, that term for our purposes today just means broken bones. You've seen the stages in a general sense, but exactly how the bone heals and how we treat fractures can vary quite a bit depending on the type of fractures. Okay, so what I want to do today is to introduce a limited selection of fracture types. I haven't chosen these by which ones are the most common, nor do I intend this to be comprehensive. Your textbook is a more complete resource, because there's a lot more information in it than I have time to give here. I'm only going to introduce some fractures, because I want to concentrate on a few different treatments, and these fracture types will work well as examples. Let's start with just a simple fracture. With a simple fracture, the bone is broken, but there might be little damage to the tissue around the bone. Now, to talk about the number of breaks in a bone, we talk about a single, a double, or a multiple break. A single fracture means one break. A double fracture means two breaks, and a multiple fracture means more than two breaks. So let's start with the treatment of a simple fracture. The treatment for it depends on how much the bone has been displaced from its normal position. If the bone hasn't moved much, then it will just have to be immobilized to make sure it doesn't move around while it's healing. If the bone has moved enough that it will interfere with proper healing and function, then, well, it'll have to be moved back into its original position before immobilizing it. In everyday speech, people say that we set the bone, but doctors talk of reducing the fracture. That is, we reduce the amount by which the bone is out of place. Sometimes these kinds of breaks are not so serious. A break in a small bone, for example. But of course, if the patient is elderly and if it's a long bone in the leg, well, a simple fracture can be anything but. Okay, let's imagine a really common kind of fracture. I want you to envision what happens when someone falls. A person, perhaps your father, might be walking on an uneven sidewalk and stumble, or be crossing an icy parking lot, maybe trip over something in his house. But think about what happens as he goes down. That's right, he throws out his hands to catch himself and keep his head from hitting the ground. When he puts out his hands, all of his weight goes onto his arms, and the radius, that is the long bone in the forearm next to the thumb, this bone is a weak point. So it can break and slide up over or under the wrist bone. This is called the callus fracture. Now, the treatment depends on how much the bone is displaced or moved from where it should be. In some cases, it's relatively minor, so the doctor may not have to reduce the fracture at all, and just put a hard cast on it so it doesn't move. Now, the worst kind of fracture is what is sometimes called a compound fracture. The terminology is very confusing because this sounds like the number of breaks in the bone, doesn't it? But actually, the term does not technically refer to the number of breaks at all, but refers to whether the bone has come through the skin and how much damage has been done. So, I'm going to use the term open fracture. I think that's a much clearer way to refer to it. My point is, if you hear the name compound fracture, it refers to the severity of the injury, and often not directly to the number of breaks in the bone. Okay, so an open fracture is one where the fractured bone does significant tissue damage. And, worst of all, as I said, it penetrates the skin. There are all kinds of potentially harmful bacteria on the skin, and whether the bone goes into the skin or not, this kind of fracture requires significant intervention, usually surgery, to clean out all of the bacteria and remove dead tissue. Basically, extensive procedures to prevent bone infection, which is very difficult to treat. So, as far as seriousness, an open fracture is much more life-threatening than other types of fractures. All right then, there's one other type of fracture that I want to talk about today, and that's the green stick fracture. A green stick fracture means that the bone bends, and maybe it breaks part of the way, but it doesn't break all the way through. These fractures are mostly found in children because their bones are much more flexible than adults. Oh, and the name green stick refers to a young green plant that might bend instead of breaking. Now, I see some of you looking concerned about this fracture happening to children, but actually a green stick fracture is usually the least serious type of fracture. This is because the bone isn't broken all the way through. And the ability of children's bones to heal is absolutely astonishing. The bone doesn't have to be moved at all, and it heals quickly and completely if treated. Okay, there's your selection of fractures. Now let's talk about what happens after the patient comes in.